My name is Margaret Boltis, and I am a nurse. I'm also a nurse practitioner. In nursing, shared decision making is absolutely essential in working with patients and other providers. In the acute care setting, for example, setting up a patient's schedule for the day. There's lots of medical treatments, therapies, there's medications you have to give, there's other things that you would have to do with a patient. Patients also have plans for their day, even though they're in the hospital. They may have other things going on, family coming, a TV show that they really want to watch, or maybe they have something special they'd like to eat for lunch. So working with your patient at the start of the shift and doing that shared decision making, setting up the plan for the day is essential. In outpatient settings, it's even more essential. Patients come in and they have a chief complaint, and sometimes they don't always share everything that's on their mind with their physician or the therapist or the provider that they're going to see. So exploring with your patient, is there anything else you have questions about? Something that's maybe not particularly related that can affect the care that's being provided. So in those circumstances, it's important as well. As far as a particular time that I had a situation where shared decision making really made an improvement in an outcome, I was working with a family, and the mother had come in, the child had repeated strep infections. And the strep throat was really just not getting treated, and no one really bothered to ask or explore why. And so the patient came in and again was prescribed the exact same medication that they had been prescribed a couple times previously. And so I sat down with the mom and I kind of talked to her and I said, well, why do you think that the infection's not getting treated? And as we talked a little bit more, we found out that mom didn't have a real stable home situation. She was not in the same home each night. Sometimes she was spending nights in shelters. Sometimes she was spending nights in other people's homes. And the medication she had been prescribed was given 3 times a day and needed to be refrigerated. So in that particular case, that medication wasn't working out for them. So I encouraged her to share that with the provider, and we kind of all sat down and we talked about there were several different medications we could use to treat this infection. In the end, we actually settled on a 1 IM injection for this patient so that they would be treated and done for, and the mom didn't have to continue trying to give medication and arrange that. So in that circumstance, that shared decision-making really improved the outcome. I think as a nurse, using the share approach is going to make your job a lot easier and a lot smoother and also a lot more enjoyable.